I will now call Dr Philippa Whitford, who is asked to speak for no more than 1 minute. Dr Philippa Whitford.
Thank you very much, Mr Speaker. The London School of Economics reported there were over 23,000 excess deaths in care homes in England and Wales, but only 12,000 were put down as due to COVID. How does the Secretary of State explain the other 10,000? Testing of care home staff is critical to reduce spread, but how will he improve the return of results to local GPs and public health teams? Concerns have been raised that a quarter of tests are false negatives, which could send staff with the virus back into care homes and hospitals. It's a difficult sample to take, so is there any comparison being done between self-administered tests and those carried out by healthcare staff? And finally, where is the green paper that was promised in 2017?
Thank you very much, Mr Speaker. On the point about tests, absolutely work was done and carried out to assess the difference in efficacy between professionally administered and home-administered, self-administered tests, and found that the efficacy was very, very similar and not significantly different. And that's why across England and Scotland and the whole UK we use home tests. That's an important part of our testing regime. She asks about the difference, the increase in, sadly, the increased number of deaths that there have been in care homes. She's absolutely right that there's been an increase, and we analyse the causes of all of the different factors that may have had an impact, and this is something that our clinical advisors are looking at. The same is true in Scotland, I think, and I'm sure that the Scottish medical advisors are looking into the same. And when it comes to a green paper, at the moment we're working on crisis response, and I think that's the appropriate thing to do.